I'm Alyssa Bombasino.
I'm Samantha D. Hall.
Jason Barrios.
Tristan Vasberg.
And I'm Abigail Golseth, and you're watching Disney Channel.
Dun 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 dun.
Oh no, this has peanuts.
Are you allergic to peanuts? Do you have an EpiPen on you? I think this patient's experienced anaphylactic shock.
This patient is experiencing anaphylactic shock. Anaphylaxis is a severe and potentially life-threatening allergic reaction that can occur rapidly, often within minutes, of exposure to an allergen. Common triggers include certain foods like peanuts or shellfish, insect stings, certain foods, medications, and latex. During anaphylaxis, the immune system reacts excessively to the allergen, causing widespread release of chemicals, such as histamine. This can lead to symptoms like difficulty breathing, swelling of the throat, hives, and rapid drop in blood pressure, and even loss of consciousness. This is a classic condition presenting with skin, hives, flushing, or swelling. It could cause respiratory difficulty breathing, wheezing, or throat tightness. It could also cause a rapid heartbeat, low blood pressure, or fainting. It could also cause nausea, vomiting, or diarrhea. Atypical presentations of anaphylaxis can occur and may not fit the classic mold. For instance, some patients might experience delayed onset symptoms, where the reaction occurs hours after exposure. Others may have less obvious symptoms like fatigue, confusion, or gastrointestinal distress without the typical skin or respiratory involvement. Patients with atypical presentations might not have a clear history of previous reactions or may have minimal exposure to known allergens, complicating diagnosis.
Do you know how to use this? So what you're gonna do, we're gonna lay you down, go on your back. We're gonna put your hand around this. Don't put your thumb on the top. With the orange part, you're gonna put it into the side of your thigh. You're gonna wait till you hear a click and then hold for 10 seconds. Go.
2, 3, 4, 5, 6, 7, 8, 9, 10.
This is AviQ. It's going to be another form of an EpiPen.
This trainer contains no needle or drug and is for training purposes only. Do not use this trainer during an allergic emergency. If you are ready to use, pull red safety guard down and off of this trainer. Place black end against outer thigh. Then push firmly until you hear a click and hiss sound. 2, 1. Training complete.
Even though an EpiPen was administered by the patient, I still have to call 911 because she might need more than one dose.
Some differential diagnoses for anaphylactic shock are vasovagal syncope. Both can present with fainting, dizziness, and rapid heartbeat. Some differences is that vasovagal syncope is usually triggered by stress, pain, or standing for long periods. It's often accompanied by a slow heart rate and not associated with respiratory distress or skin symptoms. Another differential diagnosis is an asthma attack. Both can involve difficulty breathing and wheezing. An asthma attack typically does not cause skin reactions or other GI symptoms and usually reports to bronchodilators instead of an epinephrine pen. Let's wheel out.
Some red flags for anaphylaxis include difficulty breathing or swallowing, swelling of the face, lips, or throat, rapid or weak pulse, dizziness or fainting, a widespread rash or hives, and symptoms that worsen rapidly.
Anaphylaxis can be categorized into different types based on the triggers, including food-induced anaphylaxis, which is often a result of nuts, shellfish, or dairy, which are going to be most common, insect sting anaphylaxis, which is triggered by a bee sting or wasp sting, and then a medication-induced anaphylaxis, usually from antibiotics or non-steroidal anti-inflammatory drugs, also known as NSAIDs. There are typically no chronic forms of anaphylaxis, but individuals may have recurrent episodes upon re-exposure to an allergen.
Some possible progressions for anaphylactic shock. It can progress into respiratory distress due to airway obstruction and respiratory failure. It can also progress into cardiovascular failure, leading to shock, and it can also turn into biphasic anaphylaxis, where the symptoms return after an initial resolution. And that's all.